There are so many questions about health insurance, especially Medicare, when you get to be that age, and especially when you get to our parents' age and you need to use Medicare all the time. But when do you get it? How do you get it? There's so many questions out there.
And I'm glad to be able to help shed some light on that today, but I don't have the answers. We are bringing in Lee Green, who is a Medicare specialist, an independent insurance agent, because we know you have the answers. We just have the questions. So glad for you to be with us today.
Thank you. Good to be here.
Well, I mean, this sounds sort of silly, but how do you actually sign up for Medicare? Does it just automatically happen when you turn 65, or do you have to sign up?
Well, great question. If people are already getting Social Security, Kim, when they turn 65, because you could sign up for Social Security as early as 62. Mm-hmm. If you're already getting a Social Security check, then Social Security, that's who runs the Medicare program, they will automatically sign you up for Medicare Part A and Part B. That's hospital coverage and medical coverage. And they will send you your red, white, and blue Medicare card about 3 months before your 65th birthday month, because Medicare always starts on the first day of the month in which you turn 65.
Okay, so definitely tied to your Social Security.
It could be. If you're getting Social Security, they'll automatically sign you up for Medicare A and B and send you a card. If you've decided to put off Social Security until you're 68 or even 70, then essentially you need to proactively sign up for Medicare. Primarily by going online onto the Social Security website, and there's a box on the homepage called "Click here to enroll in Medicare," and you answer about 10 questions: name, address, date of birth. Click submit, and in about 10 days, you'll get your Medicare card. It's that simple.
So if you are still working past 65, you don't have to get Medicare. You don't have to pay for Medicare. You can wait if you have your own health insurance with the company that you work for.
That's a great question, Mike. If you are working past 65, and certainly a lot of us are these days, if your company has less than 20 employees, then you do have to sign up for Medicare A and B when you turn 65, because Medicare then becomes primary and your employer plan, if you decide to keep it, becomes secondary. So it is you must do that. If you're with a larger company of more than 20 employees, you should sign up for Medicare Part A because it's the hospital coverage and it doesn't cost anything. So I always advise my clients to sign up for Part A. Unless, of course, you have a health savings account at work.
Just to add a little more confusion, right?
Yeah. If you're putting money in an HSA, do not sign up for Medicare A and B because you will have a IRS tax penalty. So I always ask people, you're still working. Do you have an HSA at work? If they say, no, I don't, sign up for Part A. There's no cost to it. And you can keep your employer plan as primary. This is a company of more than 20 employees. And then your Medicare Part A would help with any inpatient bills. Go ahead.
No, you go ahead.
I was going to say, to Mike's point, you can put off signing up for Medicare Part B, which you have to pay for. It starts at $148.50 a month, but it is tied to your income. You can put that off for as long as you want, as long as you have employer coverage. And you could sign up for Medicare Part B at age 70, no penalty, no financial penalty. So a lot of people put that off because they're like, I have great employer coverage. Why should I pay $148 a month when I have tremendous coverage through my company?
And it's not like life insurance where you should do it early because it'll cost more later. It's okay to wait until you're retired at 70 or 72 or something like that.
Right. It's not like life insurance in that respect. I mean, the Part B premium of $148.50, that's going to go up $5 to $8 a month, but that's going to go up regardless of whether you put it off or you sign up at age 65. And some of the supplement products that we'll talk about in a second are based on your age. But again, if you sign up at 65, by the time you're 70, it may have gone up 25%. So you're not really going to be penalized, to your point, Mike, if you put it off.
And do you have to be a U.S. citizen to qualify for Medicare?
Great question. You do not. can either be a U.S. citizen or you could be a permanent resident with a green card, as long as you have resided in the United States for the 5 years prior to signing up for Medicare Part A and B.
Okay. And does it matter where you live? I know a lot of
Go ahead.
grandparents move to be closer to their kids, but mainly their grandchildren. So if you move from Texas to Wisconsin or Texas to Florida or to wherever you move, does it matter?
It doesn't matter. No, Medicare A and B is good anywhere in the United States.
Okay.
Medicare does not cover you outside of the country. Very important to know.
Okay.
And then if you choose a Medicare Advantage plan or a supplement plan, because a very important takeaway from this interview is that Medicare A and B only pays about 80% of your doctor bills. So if all you do is enroll in Medicare and you don't enroll in a supplement or an Advantage plan, you're on the hook for 20% of an unlimited number. And I don't advise that, obviously, for anybody. But if you do move from Dallas to Houston or New Jersey to Texas, there are a number of special enrollment periods that allow people to change their coverage.
Okay. So if you have a supplemental plan, perhaps there are supplemental plans that don't practice necessarily in the state where you are. In the supplemental plans, could you run into that issue? But with Medicare in general, you wouldn't?
Well, there are two options once you get your Medicare card. You can either have a Medicare supplement, which picks up the other 20%. And with a supplement, you can go to any doctor in the country that sees Medicare patients. And essentially, other than a $203 deductible, it pays all your bills. You could go to the Mayo Clinic, you could go to MD Anderson, you could go to Johns Hopkins. There's no network restrictions.
Wow.
You would have to get a separate drug plan because Medicare A and B doesn't cover prescriptions at Walgreens or CVS or HEB. The other option, instead of a Medicare supplement, would be a Medicare Advantage HMO or PPO, which has typically a monthly premium of $0. It has a lot of bonus benefits that are not typically covered by Medicare, like dental, vision, hearing, free gym membership, a quarterly over-the-counter card. They make it very attractive, and a lot of people do sign up for Advantage plans. The Advantage plans do have a network that they want you to use, and they often have co-pays for services. So if you're in Austin and you're in a Medicare Advantage plan with one carrier and you move to Houston, you might have to choose a different Medicare Advantage plan.
Okay.
Your Medicare supplement product, on the other hand, will go with you anywhere in the country. You
Got
don't
it.
have to switch.
So a lot of it is really understanding the terminology,
Right.
and what
right,
it exactly. Because I think that a lot of times we just think, oh, I have Medicare, but we might refer to it as it's a supplement or an Advantage
plan
interchangeably, and they're definitely not.
That is correct.
Okay,
So
good to know.
And I mean, that's why it's important to sit down and talk to a specialist because, to be honest, Medicare can be very confusing. There's a lot of options. It's very difficult to compare. And, an agent will have a lot of expertise in which doctors and hospitals participate in what plan. What if you travel? What if you spend half the year in Florida? I mean, there's a lot of important questions. What if you're still covered by the state of Texas or Shell Oil? I mean, these are some of the things we get into to help people select what's the most appropriate option for them.
Right. And it's going to be different because everybody has a unique situation. But I guess the biggest takeaway that I'm hearing too is that the Advantage plan takes the place of the Medicare supplement, right?
Correct. Right. You get one or the other.
Okay.
And you see, when people try to do it themselves, if they make a choice and it's the wrong one, they could be stuck.
Okay.
Not such a good idea.
Yeah.
Right.
So,
right.
And Medicare does have an open enrollment every year from October 15th to December 7th, where people can actually shop around and make some changes to their coverage.
Okay.
I feel like there's some confusion about Medicare and Medicaid.
Yeah. How do they?
Okay,
Do you find there's confusion there, and especially how they kind of work together, so to speak?
There is, Mike. So Medicare is the federal program, and Medicaid is basically run by the state of Texas. So they do work hand in hand. Medicaid is typically based on your income situation, or there might be certain other categories that would make you eligible for qualifying for Medicaid. If you have Medicare and Medicaid, there are certain plans that you essentially should enroll in, which will provide you with 100% coverage and a lot of extra benefits.
Okay, so you actually can have both. You can be covered by both.
You can have Medicare and Medicaid.
Okay,
that is correct. Yeah, if you have both, you're known as a dual eligible.
Okay,
you have Medicare and Medicaid.
Okay.
One last question. My dad had COVID and was in the hospital for 3 days back in January of this year. And after that, because of Medicare paid for nursing visits when he got back home to his independent living. He didn't know that at the time, and I think his doctor told him that it would have. How do you find out about stuff like that? The advantages of Medicare for any type of care that you can get? Is it through a specialist like you, through your doctor, through someone else? What's the best way to go to find out what I could be missing?
Great question. So Medicare has a handbook called Medicare and You 2021 that actually lists all the benefits and services that they cover. The Medicare.gov website has all of that information on it. Certainly an agent will know exactly what's covered. Of course, you can always Google the question. But it's interesting. Home health care is covered by Medicare for medically necessary issues, but it's not covered for things like cooking, cleaning, bathing, dressing. So very big distinction, and a lot of people get confused about that.
Yeah. So I think that it's such an important topic because it's just confusing. And so we thank you so much for helping shed some light on some of the terminology and just helping us to be, because that way we can be much more educated as we advocate on behalf of our parents and certainly know what we have coming in the future as well.
Exactly.
So thanks so much.
Thank you very much.
No, my pleasure. And, look forward to helping people and basically helping them select the most appropriate plan for them.
Great. Okay. Thank you, Lee.
Yeah, it is just, there's so many things, right? Once you think you understand one thing, you realize, oh, yeah, but what about this? And so I thought I had a pretty good handle, and now I'm thinking,
and now you're going, no, I don't.
Yeah, now I'm trying to think about, what does my mom have? Okay, I need to think about, I probably called it something, which it really isn't. And so I need to go back and look
it's
at it a little
like playing
closer.
a game, and the rules are changing, and the terminology is changing all the time. So you can't keep up. It's hard to win in a game like that.
That's right. So we hope that this has been helpful for you. And if you have other topics or issues that you'd like for us to cover, be sure to let us know.